I'm the kind of person that I'm motivated and driven by just forming connections with people. And I think that's why I started my YouTube channel, because I knew that there were going to be people out there that were in the same situation as me.
Hello and welcome to In the Chair With, a new series of dental protection podcasts. My name is Lesley Harrison. I'm a dentist and a dentolegal consultant here at Dental Protection. I'm hosting a series of short podcasts where I'll be interviewing dentists and other industry figures of interest within the dental community. I'll be talking to my guests on their career, their inspirations and aspirations. I want to know what makes them tick. This is our first episode, and I am delighted today to speak with Dr Yewande Oduwole, who is a fellow dentist. I'm sure a lot of you will be familiar with Yewande due to her large following on Instagram and her involvement with numerous organisations, both while she was a student and since graduating. And we are also incredibly lucky that she's Dental Protection's Young Dentist Ambassador. So Yewande, welcome. So my first question is, what made you want to be a dentist? Was it something you always wanted to do when you were growing up?
Well, firstly, I just want to say thank you for that lovely, lovely introduction and for allowing me to be the first guest on this podcast. I feel very honoured and I feel very proud to be Dental Protection's Young Dentist Ambassador. So thank you. So to answer your question, what made me want to become a dentist? So I actually didn't always know that I want to do dentistry. I'm not one of these people that came out of the womb and like, yep, I'm going to be a dentist. I had no dentist in my family. I was actually born in Nigeria. My parents came here when I was 3. Grew up in Southeast London. I didn't have any dentists in my family. I didn't even think dentistry would be a viable career for me because I didn't really see any dentists that looked like me. So it wasn't a thing at all. I grew up thinking I wanted to be a singer, but that dream quickly died when I realized that when people asked me to sing on the spot, I'd get really shy. And I was like, okay, that's not going to work.
I thought you were going to say because you can't sing.
Well, that would be really bad. I can hold a note. But yeah, I wasn't as confident as I thought I was. But so then I started to look at what else I was good at. And I really enjoy working with people. I've always been quite a people's person. And at school, I was actually happened to be quite good at science, biology and chemistry. So I just went on to good old Google and just searched, what can I do? I love people, biology, chemistry. And then obviously like a list of jobs came up. And then I saw dentistry. I was like, okay, this seems like it combined my love for working with people, science, and it's very practical, which is a bonus because I'm quite a hands-on person. So that's when I decided, yes, I want to do dentistry.
And the rest is history.
The rest is history. It wasn't a smooth process, but...
Well, no, I was just about to ask you that. So I know you qualified from the Peninsula in 2020 and you're now in practice, but I understand that your journey to dental school wasn't quite that straightforward.
No, I wish it was, but I think it had to happen for a reason. So it all started from having to get work experience, because to apply to be a dentist, you need to get work experience. So I didn't know any dentists. It's helpful if you have some dentists, friends or family. But if you don't know anyone, getting work experience can be a very grueling process. I think I sent at least 20 letters out to many different practices. Was faced with many no's, very disheartening, but that was the first step. I didn't want to give up. Eventually, I ended up getting work experience at a practice that was like 2 hours away from my house, but I didn't care. I was like, I'm going to make this journey. And it worked. I ended up getting 3 offers into dental school the first time round. But despite having those 3 offers, I missed my grade by 1%. So you have to get all A's. I was almost there with one of the subjects, which was chemistry, 1% off. And honestly, that was one of the hardest points of my life because I was like, I've done all this hard work, got through the work experience. I actually got the offers because it's actually hard to get offers. Got the offers. Everything was almost set. And then it was just that 1%. I even got the papers remarked, everything, but they said, nope, 1%. So I had to make a decision. Was I going to give up on this dentistry dream, or was I going to carry on, retake this subject, take a gap year, but retaking the subject. And yeah, with help from family and friends and just lots of just thinking, I took the gap year, I worked, I retook the chemistry, applied again, and I got in the second time. Hooray.
I know, so you got there eventually, but I think that all of that just shows how determined you were to follow your dream of becoming a dentist. And I think that, we've only chatted for a short time, but it's clear that you are a natural at communicating with other people. And I bet that working in retail as you did before you went to uni was really good practice talking to complete strangers.
100%. I feel like that gap year, even though it was unintentional, the fact that I worked in retail and had that experience, I feel like everyone should work in retail for some time before being a dentist. It really helps. And I think now I look back, it was a blessing in disguise. And I say now that I wouldn't have it any other way.
Yeah, no, I agree, because I think that in dentistry, I think, communication is such a key part, isn't it? And, we see loads of complaints because it's communication that has failed. So it really stands you in great stead. And I think any sort of experience outside dentistry, just chatting to people just is so helpful, isn't it? I can remember when I started in practice, it was like a really steep learning curve, and it was really different from dental school. And it really just felt like I was being thrown in the deep end. And I can even remember the first filling I did, which was an upper 8 and a distal cavity, which was like just scary to say the least. But for you, I mean, it must have been so tough because you went into practice at the height of the pandemic. So how on earth did you manage?
Oh my gosh, graduating, being the class of COVID, which we called ourselves, that was tough because we didn't actually get a graduation until 2 years after. I remember the moment, it was literally March. So the term we're literally right into the term. And it was our last day of uni. They said, COVID, this is the final day of your time at dental school. And it was crazy because we didn't really get to say proper goodbyes. And it just felt unreal. I feel like COVID now, we look back and it honestly, it still feels unreal. And then having to go into practice. And during that COVID time, we had to apply for our foundation training. So it was already stressful having to do those applications.
Oh, I bet.
But luckily enough, actually, Dental Protection, they have this portal that they have online where you can actually practice loads of SJT questions. And even during that time, their wellbeing services and just having the information, they have loads of articles on the website that can guide you through the next steps to foundation training. I found that super useful. I remember I was on the website every other day, just trying to get myself ready for foundation year. So yeah, so I think it's quite fitting that I'm now the ambassador because it was really, really useful. And I don't just say that lightly because through that, I practiced day in, day out, and I actually got one of my top choices for my foundation year. That year, all I remember is just having to wear this big FFP3 mask and all those communication skills that we practiced and trying to be with patients. They could barely understand what we were saying and having to do the fallow time. And
oh, it must have been so hard. I mean, it's hard enough in any event going into practice for the first time, but with that on top of it, I mean, yeah, it must have been so difficult for all you guys who, graduated in COVID. But I think moving on to sort of like work now, I mean, you're clearly very passionate about your job as a dentist, and I know that your main interest is cosmetic dentistry.
You know what? I say it's my main interest, but I actually I like all of dentistry. I feel like cosmetic, obviously you get that instant before and after and confidence boost.
Yeah.
I think what draws me to cosmetic dentistry is the fact that people actually want to see you. It's not the cases where they're dreading to come. They've come for a reason.
Yeah.
And they want to improve their confidence. They want to improve their smiles. I love the cases. I have a patient where he's getting ready for his wedding and I'm just being part of the process. I'm actually going to the wedding next month. So actually part of that process of getting your smile together, seeing that confidence boost, seeing how happy they are, that's what gets me cosmetic.
So clearly you're interested in cosmetic dentistry, but are there any other aspects of dentistry you like, or is that just your main passion?
So I do love cosmetic dentistry because of, the before, the after, the confidence boost. However, I do love a good endo, getting people out of pain. And I think that process, I describe it as deep cleaning. I kind of get in sort of like a Zen zone when I'm doing endo. So I think there's different aspects of dentistry that I really love. And ultimately just either improving people's confidence or getting people out of pain. Those are my two main things that really get me happy.
But I mean, dentistry has changed so much over the years, and people are much more aware of having a good smile, which is why I think, cosmetic dentistry is on the increase. But also, I think, we are so much better now, aren't we, at managing anxious patients? And it is great when you finally manage to sort of change a patient's perception about what dentists are like, and actually they start, well, maybe not looking forward to coming to see you, but they're not quite as anxious as they were. So you clearly do an awful lot more than your day job. And I have to say, it makes me slightly exhausted even thinking about it. I know you started your YouTube channel while you were at dental school, but just wondered, is there anything that particularly motivates you and drives you?
Like you say, me looking at my own calendar sometimes exhausts me as well. However, I'm the kind of person that I'm motivated and driven by just forming connections with people. And I think that's why I started my YouTube channel, because I knew that there were going to be people out there that were in the same situation as me, that didn't get in the first time, that didn't feel that they could get into dentistry. And I just wanted to be that point of contact to just make them know that things can work out and everything will be okay.
Yeah.
So that's why I started it in the first place. And it just, the first video I made, I didn't even intend to make other videos. I just thought, let me just make this one video. And then more people started to watch it and they wanted more. So then that's why it went into dental school. And just that feeling of, it's as cheesy as it may sound, but helping other people achieve what they feel like they couldn't achieve. That's what really motivates me.
Yeah, and I think people find it useful, don't they, to listen to other people in a similar situation to them and think, well, actually, Yewande managed to do it. She got there. She got there after her year in retail, and I suppose that's helped you or made you want to be mentoring to aspiring dentists and dental students.
Yes, so I do that through my YouTube channel, and also I do help with sort of mock interviews. Right now it's actually interview season, so I've had a few students that I've helped with their interviews, looking at personal statements. So just the little things to just help the journey be a little bit easier for them.
Yeah, and I think it's any help people can get is always beneficial to them, isn't it? And I say listening to other people's stories that are similar to theirs will help sort of spur them on, won't it? So what advice would you give to anybody who says, I want to be a dentist? So prospective dentist, aspiring dentist, what advice would you give them? What do you wish you'd known when you started out?
Okay, good one. Do you know what? I think my first one would always be, no matter how things seem, do not give up. Like, even when it looks bleak, it looks like things are not going in your corner, everything's against you. As long as you know you've definitely tried your best, that's the first piece of advice I give. Just keep going. And also, don't compare yourself to others. I think dentistry, even in dental school, it can be quite toxic, where you're all high achievers and it's so easy to just be like, oh, this person's doing this and I'm not doing that.
Yep.
But at the end of the day, everyone has their own journey. And just because somebody seems like they're excelling now doesn't mean that everything's going to be great later. So just don't compare yourself. Just focus on your own individual journey.
No, I totally agree, because I think it's really easy, isn't it, just to feel totally inadequate when you're around some people within the profession. So, but yes, I think you're right. Focus on yourself and focus on your own journey. And I think you've achieved so much already. It's a relatively short career, isn't it, so far as a dentist? But what professional achievement are you the most proud of?
First, I feel like there's still more to go. I don't think I've achieved a lot, but at the same time, I feel like, especially as dentists, we always feel like there's more, like we're trying to get more out of ourselves. But if I had to say one thing, definitely my YouTube channel, and also being on the cover of Young Dentist magazine. That was a really big thing for me, because as the first Black female on that magazine, that was a really big achievement. And
that's amazing.
Yeah, I was really proud of that.
No, it is. That is absolutely amazing. A landmark moment.
Yeah.
So, aspirations, personal and professional perspective. What have you got?
What have I got? Oh my gosh, this is like, I'm still figuring it out, Lesley. One step at a time. I think right now I'm just happy being in general practice, doing what I enjoy on a day-to-day basis. And I guess we'll just see where it takes me. I'm really grateful to be in a practice where I get on with the people I work with. My nurse, she's actually asked me to shout her out, Simona. I work with her, I was with her today, and she takes in we have good conversations. She knows what I'm doing day to day. So I think it's really important to have people that you're getting on with, you're working with, you're in a happy work environment. And I just hope to just continue that. People say I should open a practice, but I'm not. That comes with a whole load of stresses. I don't know.
Yeah. And you've still got loads of time, haven't you? And I think you're right. I mean, it really helps to work in a supportive practice and one where you get on with people, because it just makes the working environment so much better. And you look forward to going to work, don't you? So some other questions for you now. So describe yourself in 3 words.
3 words. I'd say I am bubbly, kind, and I'm a bit shy. I'm actually shy. I know it's contradictory, bubbly and shy, but I do get quite shy.
Well, I was going to say, those are 3 words that your friends would use to describe you. But I say, having met you, I think they would definitely say bubbly, and I think they would also say kind. I've not seen the shy side of you, but it may well be there, hidden somewhere.
No, I think my friends would say, super confident, but I do get really, I get shy. I think a lot of dentistry as well is like, you're acting all the time. Not acting, but you're like, you have to feel confident even if you don't.
Well, yes, absolutely. Because I mean, you have to put any anxieties that the patient might have to rest. And I think if you come across as being a nervous wreck, I don't think that's going to do them any favours. So I think you're right. Sometimes you have to try your utmost to come across as being very confident, just to help the patients as well.
Exactly. So yeah, I'll say that.
So you've obviously got a very, very busy life. And I was going to say, what do you do in your spare time? But this is on the assumption, obviously, that you actually do have some, because I'm not sure that you do.
I need some more spare time.
No, I mean, do you do any hobbies? Have you got anything you do? I mean, you obviously sing. Do you do any singing?
Yeah, I still sing. I sing in the choir in my church. So I do love getting involved. They always do things for the community. And if you can count going on holiday as a hobby, I'm trying to do more of that, travel.
Yeah, absolutely. Absolutely. Well, that leads on to my final question. If you were on a desert island and I will allow you to take 3 things, what would they be? But because you're a dentist, I'm going to let you take your toothbrush and your toothpaste and either your floss or your TPs. So what other 3 items would you take with you?
Good question. Okay, if I'm going to go for the smart answer, a survival kit.
No, not smart. We're going to talk frivolous.
Yeah. Frivolous answer. I bring food. I bring lots of food. I'm a foodie. So my favorite food is jollof rice. It's a Nigerian food. I bring lots of that. I would bring my, what would I bring? I'd say I bring my laptop and my phone, but I wouldn't get much out of it.
No, we're not allowing you technology.
No technology, that would be wise. A book, a nice book. I do like a book. And lastly, I bring a genie with me so I can make more wishes.
What, an escape book off the desert island?
Yes, and that'll be my final thing, and then I'll just escape.
Anyway, that brings me to the end of our chat. It has been an absolute pleasure to talk to you. It's been so lovely. So thank you very, very much.
Feels like I've been chatting to a friend.
I know it's been lovely. So thank you very much. It's been an absolute pleasure. And with that, we've come to the end of this first podcast in the series. You can find links to Yewande's socials in the podcast description. I've been your host, Lesley Harrison, and thank you so much for listening.